Hello, my name is Jim McVeigh. On behalf of the Substance Use and Associated Behaviours Research Group at Manchester Metropolitan University and Anabolic Steroids UK, welcome to the conference, The Public Health Implications of Anabolic Androgenic Steroid Use. And thank you to the 300 plus delegates for joining us today. I think you'll enjoy and find today really interesting, and thank you for your support in registering and joining. I'd like to start by thanking Manchester Metropolitan University for their support in making today happen. I'd also like to thank our three major sponsors for the financial support which has made today possible. That's Exchange Supplies, Orion Medical Supplies and Vernicare Exchange. Thank you so much for your commitment and your support. I'd also like to thank a range of supporters, the drug treatment providers across the UK for their input and for promoting today's event. A number of individuals such as Michael Linnell, Martin Sissons and Mark at Fluke for their support in pulling the day together. And of course the technical team, Camille, Bartosz and Kasia, for all the preparation on making today happen and for the delivery and what I'm sure will be a successful delivery on the day of this event, and in helping us to get this online for people to see after the event. I'd also like to thank members of the conference steering group for their input at the early stages of development in their help and advice in bringing this together. I should point out, don't worry if you can't watch continuously for the full next 8 hours. There'll be the occasional 10-minute breaks, but I do appreciate that many of you won't be able to spend the next 8 hours with us. The event will be is being recorded and will be available on www.anabolicsteroids.org.uk shortly after the event. And anyone who's missed it today, or if you want to catch up on any of the specific presentations, you could just log on there and see all the content of the day. And this is an exciting time for research in this area in the UK. We have an unprecedented amount of high quality research being conducted and being published at the moment. In the UK, Anabolic Steroids UK is bringing together this data and this evidence and helping to bring together UK academics in the field, together with leading international experts and researchers and the UK practitioners, to share evidence, to exchange experience and inform best practice. The UK is in a unique position of strength in having so many needle and syringe program practitioners with an interest in an active engagement with anabolic androgenic steroid users. We need to build on this and provide them with the best evidence that we can. Ultimately, we aim to benefit the users and those contemplating the use and those affected by other people's use of anabolic androgenic steroids and other associated image and performance enhancing drugs. And we aim to do that by informing best practice and providing robust evidence. One of the key areas of work in the coming year will be the development of prevalence estimates, and this is something that we've never had before in the United Kingdom. It's a collaborative piece of work involving many different individuals and organisations, the iPed Info Group, Anabolic Steroids UK, Public Health Wales and their input at all levels of this process. Expertise from Liverpool John Moores University, the University of Birmingham, Greater Glasgow and Clyde NHS and Manchester Met are all working collaboratively with the common aim of being able to identify what the true levels of anabolic steroid use are in the UK, and as much as we can about that population to help inform how best to provide in particular harm reduction services. For the conference today, I'd really like to thank the speakers The format that we've used today is the best that we can under these circumstances in the times of COVID. It also has the advantage of being really cost effective. It means that we don't have to charge delegate fees, and we're able to provide input from speakers from across the UK, across wider Europe, the Middle East, United States and Australia. And so in that respect, it's a real advantage being able to do that at a minimal cost and no cost to the delegates. There are obviously disadvantages. It's a real pain for the speakers. It's much more time consuming, more stressful, and I'm really grateful for them for the preparation and putting their presentation together, and then making themselves available for the question and answer sessions today. Another disadvantage is you can probably hear my sick bulldog grunting in the background. It's the whole idea of working from home and the new work environment. I apologise for any interruptions from my dog. Obviously, another disadvantage is you don't have the same level of interaction that you would do at a conference, where you get to mingle with other delegates and interact with the speakers. But on balance, I think it's a great way of disseminating research and evidence to a large number of interested people and free of charge to them. So we've decided to do this again next year. But for 2021, we'll be doing it with colleagues from the University of Queensland. And in addition to the live programme being delivered to Australian time, there'll be a specific theme developed to ensure that the conference has its own character and the format and content remains fresh. We'll disseminate further information from this, in particular from the anabolicsteroids.org.uk website, and you can sign up to newsletters from there, and we'll keep you informed of developments at the new conference. But just because you can't be here in the same room as the speakers doesn't mean to say you have to be a passive audience. There'll be an opportunity to ask questions to each of the speakers, and also the chance to vote for the questions that you would like to see asked. If you take a quick look at the conference platform display, if you look on the left hand side of your screen, if you're on a computer, or on the top of it on a mobile device, you'll see the chat feature, a chat button there. That's where you ask the questions. There's also a program button there where you can see what's coming up next. And you can also get to vote up the questions that you want asked of the speakers by doing the thumbs up indicator on there. So please do participate in the day. You'll see that the day is split into 5 sessions. I won't go into details of all the speakers. There's information there on the programme and on the anabolicsteroids.org.uk website. But just to say that the sessions are divided into themes. The first one being around harms, secondly around societal backdrop and the epidemiology, including a case study from the Middle East. Then we'll be looking at different populations of users, or the typology, about women users, and about the different points on the spectrum of different anabolic steroid users, and the different issues that they may have. We'll then go on to look at treatment interventions that are in place and the evidence to support the development of those interventions. Then we'll have a conversation between William Llewellyn excuse me, and the author of Anabolics and a great advocate of harm reduction, and Joe Keane, UK practitioner and powerlifter. There'll be question and answer session at the end of each of these sessions, and finally we'll have Ian Boardley summing up with a few closing remarks. I'll leave it there. Thank you for joining us and enjoy the day.